Pathophysiology of the adrenal gland. We are going to learn some of the diseases that are associated with the adrenal gland. Some are related to its excess production, and some are related to its lower production, which is insufficiency. So we are going to start with the Addison's disease. Just to let you know that it's called Addison's disease because it's named after Thomas Edison, and he was an English physician who originally classified this disorder, and hence the name. The Addison's disease is basically when there is insufficient production of cortisol. So adrenal insufficiency. So there is less amount of cortisol produced. It can be primary, it can be secondary. For primary, it is related with less cortisol and less aldosterone. And this, when the amounts of cortisol are less, this can lead to excess production of ACTH from adrenal, from the anterior pituitary. So please understand. So it's primary Addison's disease is related with less cortisol, and so through the negative feedback loop, there is an excess production of ACTH. The secondary Addison's disease can be of two types. Number one, it can be related to less production of ACTH, which results eventually less production of cortisol. So understand, always remember, Addison's disease is related to less cortisol production. How? It may vary. So the primary we did, this is the secondary one. So according to the secondary, it can be less production of ACTH, which can be from the anterior pituitary, less ACTH production, so there is less cortisol. Or it can be at the hypothalamic level, where a CRH, which is corticotropin releasing hormone, may produce less, which can cause less production of ACTH, which in turn causes less production of cortisol. I want you to understand that there are cases like this when there results in maybe an adenoma, maybe a cancerous growth. This can affect the production of the cortisol production. It can be the pituitary gland is affected by the tumor. It can be the adrenal gland is affected by the tumor, or can the tumor can also be at the hypothalamic level. Next, going forward, is the Cushing syndrome or Cushing disease. So there is excess production of cortisol. It's just opposite of Addison's disease, where there is excess production of cortisol. Again, just remember, they are of two types. Number one is primary, the other is secondary. In the primary Cushing syndrome, there is an adrenal adenoma, as I said, or adrenal carcinoma, which results in excess production of cortisol. This excess production of cortisol can cause less or diminished production of ACTH. And the secondary can be bilateral adrenal hyperplasia, which means that in both the adrenal glands, there might be some tumor formation that can result in excess cortisol production. And this, again, can be of three different types. Number one, it can be of pituitary origin, where there is an adenoma at the anterior pituitary secreting ACTH in excess quantities. And this level of ACTH, when it's excess, it can cause excess production of cortisol. Again, it can be hypothalamic origin, where there is excess production of CRH, which causes excess production of ACTH, which in turn causes excess production of cortisol. So remember, these are just opposites of what we just learned of Addison's, but this is a tumor. It is a pathological condition that can result in it, which can actually damage the negative feedback loop in every way possible. Then the last kind in the secondary can be ectopic ACTH syndrome, ectopic where the reasons of that is unknown. Next comes hyperaldosteronism, which is basically, again, we are talking about two ways in which it can happen. One is known as primary hyperaldosteronism, or called as Cohn's disease or Cohn's syndrome. And that is very much something that is not very uncommon, I would say. This result, the cause of aldosterone hypersecretion is always almost because of adrenal adenoma. But there might be, in some cases, it might be due to adrenal carcinoma, hyperplasia, or sometimes it can be ectopic and we do not know the reason why. Okay. This leads to high level of sodium production, hypernatremia, and high levels of potassium production, which is hypokalemia. Okay, and both are extremely dangerous, and that leads to alkalosis and nephropathy, which affects the kidney drastically. Then comes the last one, which is the adrenal enzyme deficiency syndrome. So there are certain enzymes that are produced by the body in less amounts, and that can lead to several diseases, and of which one of them is 17-hydroxylase deficiency. Okay, I'm going to go over this on a slide, which is next two slides. I'm going to come back to that slide. So this actually helps you to understand the 17-hydroxylase deficiency, how it happens. Deficient activity of this enzyme can result in a deficient synthesis of cortisol. So please understand that 17-hydroxyl deficiency is important. This enzyme, when they are absent, these processes will not take place properly, and the levels of cortisol will decrease. When this level decreases, what happens is the negative feedback loop does not work properly at every level. It can be at the level of the hypothalamus and at the level of the pituitary, and this diminished 17 alpha presence and leads to less amount of production or insufficiency in cortisol production, which in turn affects the CRH, ACTH production, which causes increased production of aldosterone. So when there is a less or this negative feedback loop, what is, makes it the tissue or cell sense that there is the levels of cortisol is less. As such, it demands more aldosterone production, which causes enhanced production of aldosterone, which leads to hyperaldosteronism. So I repeat again, absence of glucocorticoid feedback to the brain results in enhanced ACTH production, and an aggravated or enhanced production of the precursor molecule results in higher level of aldosterone synthesis. So this is again a deficiency related with adrenal gland. So I'm going back, and we'll come back to the next slide. So these are the 4 different diseases associated with it. And as I said, I described each one of them. So if you go to the next page or next slide, you will see that these are at the level of the pituitary and at the gland level, how they are regulated. So this is the normal regulation, how the anterior pituitary is producing ACTH, which in turn acts on the adrenal gland to produce cortisol, and the negative feedback goes on and on. In case of primary Addison's disease, you can see that in this case, the ACTH production is fine, but there is less production of cortisol. If we go to the secondary Addison's disease, you will see that in both the cases, it is ACTH is produced in lower quantities, which in turn cannot affect the glands, which in turn affects the production of cortisol from the adrenal gland. And there can be many causes for it, but the level of cortisol definitely lowers. The other is the Cushing disease, and the primary, secondary is shown in here. Here, primary, again, this is more related to the anterior pituitary, as you can see. There is excess production in Cushing disease for cortisol. Here, the adrenal gland produces the hormone in excess level. As a result, the negative feedback loop is working. As a result, ACTH is produced in low levels. Okay. On the other hand, if we go to the secondary Cushing disease, you will see it can be both ways. It can be that the excess cortisol production affects the ACTH production, or it can also be affected at the hypothalamic level. Okay, so these are the different pathological uh, conditions in which you will see that these diseases directly affect the production of these hormones, and these in turn affects the body in several ways. We will not be discussing about the symptoms and the medicines that can actually help to alleviate this or reduce the pathological symptoms, since we are very much focused on the hormone production. Okay.